And the question I'm going to answer tonight is, what are the risks of mixing oxycodone with Suboxone? Or, another way to put this question is, what are the risks of mixing pain medication with Suboxone? And that's pretty simple. So pain medication, I'm going to assume that we're talking about the class of pain medications that are opioids. Vicodin, Roxy's, Oxycodone is the more common name. Norcos is another name. And these are all opioid-based medications. And the risk of mixing these with Suboxone is very simple. If you take it when there's no Suboxone in your system and the opiate receptors are not blocked, you follow this with taking Suboxone, what happens is very simple. The opioid, let's say you're taking some Vicodin, okay, and there's no Suboxone in your system. Now you take Suboxone, which the main compound in there, and the generic name is buprenorphine. What buprenorphine does, to put it very simply, is it goes in your body, it goes in your nervous system and wherever else opioid receptors are, and it kicks out the Vicodin very rapidly, the oxycodone very rapidly, the Norco very rapidly, and you get what's called precipitated withdrawals. And we all know what withdrawals are, but for those of you that don't, a withdrawal is coming off of the opioids and the way your body feels as these opioids are coming off of your receptors. Some of the common symptoms: sweating, anxiety, rapid heart rate, nausea, vomiting, chills, goosebumps, etc. Those are withdrawals, okay? A typical withdrawal would be as such. Let's say you're using the pain medication very regularly, you stop using it, your body has built a tolerance to it, and as it starts to crave these medications that you're taking on a regular basis, you start to have symptoms. And these symptoms are, as I said, sweating, nausea, vomiting, chills, nervousness, etc. All right? If there's no Suboxone, or rather buprenorphine in your system, you take the Vicodin and the oxycodone, okay? And if you're a regular user, you have this stuff in your system, then you take the Suboxone. What it does is it rapidly kicks out the opioid drug that is in your body. Let's use Vicodin, for example. It rapidly kicks out the opioid drug that is on your opioid receptors, and you get what's called precipitated withdrawals, which is a very rapid, hyperacute, even worse than regular withdrawal sensation. That is the risk of adding Suboxone after your receptors are filled out with opioids, okay? Now let's take the opposite scenario. Let's say you have Suboxone on all of your receptors. Let's say you took Suboxone 2 hours ago, and what you do from that point on is you take 30 milligrams of oxycodone, okay? What happens there? Because the Suboxone binds so much more tightly to your receptors, the oxycodone goes down there, tries to bind to your receptors, and it can't bind because the Suboxone binds so much tighter. And so what happens is the oxycodone just goes through your system and it flushes out. Again, I'm going to repeat this. If you take, let's use oxycodone as our example. If you take oxycodone, okay, it's on all of your receptors, your opioid receptors, and they're all filled up with oxycodone, okay? Now you take the Suboxone. Because the Suboxone has a much more greater affinity for your opioid receptors, it kicks out all of the oxycodones, and then it binds to your receptors. And because of the way it binds, it's called an agonist-antagonist. The way it binds, you no longer get the euphoria and your body feels like it doesn't have opioids in them, and you get what's called a precipitated withdrawal, which is a hyperacute sensation of the usual withdrawals you get as these opioids fall off your receptor. That's if you take the Suboxone after your receptors are filled with oxycodone. On the other hand, if your receptors are filled with Suboxone, now you take the 30 milligrams of oxycodone. Because the Suboxone has a property that it binds much more tightly to your receptors, you do not feel the Suboxone. There's nothing to feel anyway, but essentially, I'm sorry, you do not feel the oxycodone because the oxycodone does not bind as tightly to the receptor as the Suboxone. So imagine if you put oxycodone in your body, at the same time you put buprenorphine in your body, that buprenorphine has a much higher affinity for that receptor than oxycodone, that therefore binds faster and tighter. And if there's oxycodone there, it kicks it out. So the risk of mixing oxycodone and Suboxone, if you're a regular user, and if you miss the timing of the way you do it, which I can't see why anybody would do it, but heroin addicts and substance abusers do this all the time, where they try to get clean for a couple of days that they use, and they try and get clean, and it becomes a vicious cycle. But essentially, the risk of mixing these two is precipitated withdrawals. Thank you very much. Please go ahead and type in any questions that you have regarding this video.